So again, welcome to this free webinar hosted by Prevention Plus Wellness in St. Augustine, Florida. I'm Dr. Charlie Wirch. And you can see the topic today, integrating a wellness and substance use prevention. It's a topic that we've presented, but this is new content, and it's more, I think it's going to be more relevant for the work of those of you that are in the prevention space and mental health space. So again, like most of our webinars, you don't need to contact me after the session. I will be sending all of you who have registered the slides that you'll be seeing today, and the slides have a lot of the slides have links to additional content, so you'll be able to gather more information. I'll send you a link to the recorded session as well as to a CEU certificate. So all of that will be in one link. I'll send you that out likely this afternoon, so at the latest tomorrow. So check your mailboxes. Sometimes it goes to spam. Make sure that you get that email from me so that you get the slides, the recording of the webinar, and also the certificate if you need it. All right, so the purpose of today's webinar is for all of you to gain an understanding of the critical role of wellness in substance use prevention practice for enhancing the mental, the physical well-being, even the performance and happiness of youth and young adults. Specifically, we've got three objectives for today. Number one, you'll be able to describe models of wellness and how wellness relates to substance abuse recovery and prevention. So a little history there and some key concepts. Secondly, you'll be able to review examples of how to address specific wellness directions. I would say wellness dimensions, specific wellness dimensions, as well as well-being dimensions or components in relation to prevention practice. So we're going to look at those wellness dimensions, well-being components, and what they have to do with prevention practice. So that's all new content. And then lastly, the 6 reasons for integrating wellness into substance use prevention. It'll be sort of a review of what we talked about earlier. So all throughout this, lots of slides, lots of content. You're welcome to interject at any time. We'll wait for the Q&A at the end. If you do have a question, if you do have a comment, if you want to be heard, if there's anything unclear, go to the Q&A in your toolbar and put that information there. Otherwise, don't put it in chat because it can be lost in the chat. So the chat space right now is for those of you that want to introduce yourselves, your name, your organization, particularly where you're from, the state in particular, so we can see where people are calling in from. I normally like to look at that and share that with others, but we have so much today, I'm going to forego that. And in fact, I'm going to start by launching a very brief poll for those of you who are here that are online to participate in that poll. If you can, if you're joining us where you have the capability of answering these 3 very brief questions, they're just yes or no questions, I believe, all 3 of them. You can scroll down to see all 3. You'll have them pop up in just a moment in front of you. So do answer all 3 if you have the capability of doing that. If you're on the phone, obviously you can't, but you'll be able to hear how people answered. I'd like to see people, as many people as possible, respond because we get a sense of who's on and what the needs are and interests are of our participants for today. So you got 3 questions. Scroll down so you can see all 3. I want you to answer all 3 if you have a chance. And I'll just give you a minute or so to complete those questions so we can see and get some feedback from everyone. So right now we've got, let's see, 65% of you have participated. That's a great number. Let's see if we can perhaps get that up to 70% at least. Oftentimes we're up to 70, almost 80% of participants. So if you can participate, please do. We're up to 69%. That's amazing. Thank you so much. Just give you another 30 seconds. We already have seven out of 10 of you have already participated, which is fantastic. So just a few more seconds and let everybody participate that wants to participate. Remember, there's 3 questions there. So scroll down to see all 3 questions. They're just yes or no questions, very simple questions. I'll just give you another few more moments to answer these questions so that you can participate. And we're up to 74%. Why don't we just hang in there, see if we can get 75% participating? So, oh, it just jumped down to 73. That we're going in the wrong direction. So let me just wait another 74%, almost there. As soon as we get up to, yes, 75%. Awesome. Thank you, guys. And back to 74. I'm gonna shut it off right here. We're back up to 75 to 74. All right. I'm gonna end the poll and I'm gonna send the results to you. Here they come. They'll just take a moment and I'll read them for you. The first question is, can you define the term wellness? And amazingly, 89% of you said yes. That's fantastic. So we're all on the same page. We'll compare definitions, of course, as we go along today. So it's people that are here that know a little bit about wellness, which is fantastic. I ran into a person not too long ago in the substance use prevention space that didn't know what wellness was. So I'm glad most of you do. And we will be discovering and discussing different definitions and concepts of wellness in today's session. Question 2, is wellness important to drug prevention practice? And 98% of you said yes, and that makes sense because you're online and you believe wellness is an important piece to prevention, and thank you for joining us. So we're talking to people who already have some knowledge in this area and some understanding of the importance of wellness. And then lastly, have you implemented wellness and well-being into your drug prevention practice? And here we have 73%. The majority of you have said yes, but we have 18% that have said no. So those that said yes, I think you'll like some of the ideas that we're going to share with you that make you think about maybe some other ways to implement wellness. You are welcome to share your ways that you've implemented wellness in your organization, in your practice, in the Q&A space. And yet here we had 18%, a good number, and then an additional 8% said they don't know if they've implemented wellness in their prevention practice. So for those of you people, I think in particular, I think this is going to be very, very important and helpful for you. So enough with that. Let's jump right into the slides and start with wellness definitions and models. So one of the most important early, and perhaps the earliest, well, not the earliest, but one of the earliest in modern times is definitions of health was by the World Health Organization in 1948. And the World Health Organization, WHO, defined wellness as, and you can see it in the left-hand box on part of your slide, a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So wellness was more than just not being sick, not being injured, not having a disease, but it was broader than that. It was multidimensional, and in fact, more than just multidimensional, these dimensions, these components, these factors were interconnected. They influenced each other to make the whole, and that's what wellness is about. There's no, one consensus for the definition of wellness, but you will see overlapping concepts like multidimensionality, that interact with each other, and that it's more than simply a lack of illness. There was a document written by what so-called father of the wellness movement, Halbert Dunn, in 1959. He wrote this conceptualized wellness as a health grid, which was, sort of a precursor to, a are more broad environmental, a multidimensional conceptions of health and well-being. And here it is. Here's the health grid that Halbert Dunn came up with. It's got two axes. The horizontal axis, one that runs from left to right, is the health axis. That's really he's identifying on this axis from left to right, left being not so healthy, right being more healthy, are your health habits, your health behaviors. And then the vertical axis going up and down in both directions, they're practicing healthy behaviors, they're physically active, eating well, etc. And at the same time, they're in healthy environments, social environments, physical environments, water's clean, etc., food quality is good. So that's high-level wellness. That's the purple. The opposite of high-level wellness is diagonally down in the red area, the poor health area. And that quadrant is a result of poor healthy habits and an unhealthy environment. So you've got high-level wellness in the upper right-hand corner, poor health in the lower left-hand corner, and then in the right-hand corner, where you've got healthy habits but a poor environment, Dunn labeled this as an emergent high-level wellness. So there's some potential for a high-level wellness because of the practices of those individuals, but not. But what's keeping them back is the environment is not healthy. And then the yellow upper left-hand quadrant is protected poor health, where the environment is healthy, the physical environment, social environment is healthy, but the practices of those individuals are poor. The individual health practices are poor. So that's the health grid. It identified very early on that health is multidimensional, in this case, behaviors and environment, so much more than that, but that's a very common and expanded upon concept of health. The National Wellness Institute has been around for a good number of decades, and they have taken the lead on focusing on wellness, and they talk about wellness and define wellness and focus on us becoming aware of and making choices towards. So it's so awareness is essential. I mean, it's just to improve our well-being, and some personal choices, some decision making, some personal responsibility is involved in their definition, National Wellness Institute definition of wellness, and the result or the potential result is full potential. So we're talking about beyond just a lack of illness, we're talking about full human development, sort of like Abraham Maslow's, wellness kind of notions. And the Wellness Institute talked about multidimensional, holistic, lifestyle, mental health, spiritual well-being, environment, all. So they broaden the elements involved in this concept of wellness. Wellness is positive and it's affirming. So that's, I think, a really important part of wellness versus maybe a treatment. Our medical system focused on treatment and illness, or even prevention, which focuses a lot of times primarily on risk. Wellness is positive and affirmative, and the National Wellness Institute identified 6 dimensions. 6 dimensions, and you can see them there at the bottom of the slide. So that's National Wellness Institute. And then in 2020, for the first time, Healthy People 2020, this comes out every 10 years, Healthy People, their goals for health for the nation. They came up with health-related quality of life and well-being. This was a first-time mention of this. Improved health-related quality of life, HRQOL, as health-related quality of life for individuals. That was the goal for all individuals to improve in that. And health-related quality of life is defined as a multidimensional concept, includes physical, mental, emotional, social functioning, so very much related to wellness. That's why I'm sharing it with you. So this is National Health Objectives for the Nation, Healthy People 2020. We're halfway through this decade, and so, but unfortunately, we're not collecting data on these things. And so, but nonetheless, their mention of well-being, which is essentially wellness. You know, sometimes these two terms, wellness, well-being, are used interchangeably, and sometimes there are some slight differences. But in this case, very much like wellness, well-being, a relative state where one maximizes his or her physical, mental, social functioning, includes supportive environment, satisfying and productive life. So a very, very broad conception of health-related quality of life and well-being. Instead of the traditional view of prevention as only avoiding or minimizing illness and risk factors, well-being is also focused on disease resistance, resiliency, and self-management. You'll see that in both the description of and models of wellness and well-being. And then in 2010, the Substance Abuse Mental Health Services Administration came up with their wellness initiative, and they have their own definition. You can see in the top of the slide here for what they view as wellness as positive purpose in life, satisfying work and play, joyful relationships, healthy body and living environment, even happiness. And so they highlighted three really important things, I think, related to what wellness was. Wellness integrates behavioral and physical health. In other words, they viewed the mind and the body as one component, one whole component that influence each other. And they said that behavioral health is inseparable to physical health, and of course, vice versa. And so that's really been the trend for the past several decades. Now we're trying to decide what that means in terms of actual practice. But then SAMHSA also said in their wellness initiative that wellness is empowering. It's prevention oriented. Unlike the disease or treatment model, it's focused on positive goals. Individuals and communities set positive goals, learning self-management or self-control skills, and developing healthy habits. And that it's a journey, not a destination. In other words, it's something that takes place throughout our lives. But remember the early definition, you have to have a certain level of awareness of these concepts to be able to work toward improved wellness. So wellness and recovery, let's just talk about that very briefly. So SAMHSA defined recovery as a process of change through which an individual improves their health and wellness. So SAMHSA has wellness built into the definition of recovery. We talked about the wellness initiative of SAMHSA, and then SAMHSA also said wellness is central to recovery from behavioral health conditions. Wellness is central to recovery. So there's been this long built-in emphasis of wellness in recovery, and the prevention field is a little bit behind in outside of our group here today, I think, grasping the importance, the essential need to integrate wellness and prevention, which is what today's webinar is about. A little bit more about wellness and recovery. People with serious mental health or substance use disorders are dying decades earlier. That was identified by SAMHSA in 2020, 2021, and so that's why they had the wellness initiative. And SAMHSA said wellness as an organization, SAMHSA came out and said wellness is important to improve the quality and years of life. Wellness is important to improving the quality and years of life for those that are dealing with behavioral health issues, whether those are mental health or substance abuse issues. Wellness is ubiquitous. In other words, when we talk about recovery, you can't go to a wellness, to a recovery site or recovery organization and not find mention of wellness somewhere in there. And so we did a quick search, online search, using the term wellness and recovery, and we found 829 million results. Shows you the breadth of the focus and the linkage between wellness and recovery. And so the question now for those of us in prevention is wellness also important or even essential for substance use and misuse prevention? Of course, the short answer is yes, but the long answer is we'll take a look at some information to support that yes. So this was a study or a report by NIH, National Institutes of Health, mental health and well-being for the prevention of substance use disorders. This document highlighted that there's a clear relationship between problematic substance use and poor well-being, and that the pathways for developing mental health issues and resiliency and well-being overlap with each other. So the conclusion in this particular article by these authors was that universal interventions, which included multiple components like nutrition, physical exercise, self-regulation, are likely to have greater effects on well-being and mental morbidity than more narrowly focused prevention and health efforts. So wellness and drug use prevention. This another article on this topic. This was a review of research, and the research reviewed showed that wellness or well-being, in this case they use them interchangeably, I believe, is clearly linked to substance use and mental health. Programs that promote wellness are important for preventing problematic substance use. So wellness promoting lifestyles, physical activity, nutrition, sleep, self-care, all promote mental health and less substance use. So wellness definitely essential to substance use prevention. Now, this is new content here. Well, some of this already presented as new content, but this whole section on Substance Abuse Mental Health Services Administration's 8 interactive dimensions of wellness. Remember, the National Wellness Institute had 6, SAMHSA has 8. So a couple more, but we're going to take a look at these 8 dimensions, SAMHSA's 8 interactive dimensions of wellness. You can see them here on the right: the physical, intellectual, financial, environmental, spiritual, as well as social, occupational, and finally emotional. All of those are dimensions, multidimensional. They influence each other for increasing or decreasing whole health, wellness, well-being, whatever you want to call it, full potential of an individual. And so let's take a look at each one of these dimensions a little bit more closely. And I've come up with one example of how prevention providers like yourselves and mental health providers can use these, actual implications of these for actual practice in preventing substance use and improving mental health. So let's start with physical. So again, this is a description of this dimension, as well as prevention application. This is just my one prevention or 2 prevention applications. At the bottom of this slide, and at the bottom of all these slides, you'll see others. This is where it's up to you to add your own creative spin on this. How can you address the physical dimension within your substance use and misuse prevention practice? So the definition, SAMHSA's definition of the wellness dimension is recognizing the need for physical activity, diet, sleep, and nutrition. Now, here's one way one example or one application of this. My example for you, and you can give this some thought. You could try this, or you can come up with your own. But number two, communicating the benefits of healthy behaviors and how they help avoid drug use and promote mental and physical well-being and even performance and happiness is a great application of this. Secondly, under number three, you can also discuss with young people, in particular, how substance use harms one's ability to engage in healthy habits. In other words, how does marijuana harm your ability to engage in daily physical activity? And also how substance use harms achieving personal improvement goals. Those could be goals related to healthy behavior, but it could also be goals to achieving, have success in school or a career or a job or relationships or whatever the case might be. So this two component communication, communicating the benefits of healthy behaviors and then how substance use interferes, is actually a prevention plus wellness model for integrating behavioral and physical health messaging. That's the model that we use for connecting or integrating health promoting behaviors with substance use prevention behaviors. Now, number five, you can come up with your own creative ideas, or you can take what I just said here under number 2 and 3 and then come up with your own spin of it as how you can implement this. And you may already be doing this in your prevention practice, and you're welcome to share that in the Q&A, and we can look at that at the end of today's session. That's the physical dimension of wellness, according to SAMHSA. Here's the intellectual dimension. The description is under number 1, recognize creative abilities and finding ways to expand knowledge and skills. One application that I came up with is number 2, have youth explore new hobbies, experiences, activities that interest them and promote mental and social development. And then under number 3, discuss how drug use harms brain development, thinking, learning, and educational success. Now, I already believe that probably most of you already are doing number 3. You're already providing how drug use harms brain development and learning, but you may not be addressing the first part of that, number 2, where you then link that to them enjoying various hobbies, experiences, and social activities. Now, you may come up with some other ideas. That's why there's a number 4 there. Or you may come up with some ideas as how you can actually implement item number 2 and 3 to promote this intellectual dimension of young people or young adults or even adults that you're working with in your practice. Another dimension, a third dimension for wellness, according to SAMHSA, is financial. It's described as satisfaction with current and future financial situations. One application of this I came up with was number 2, share resources with students about local opportunities for part-time work and opportunities to make money. Number 3, have youth create a prioritized list of what they'd like to spend their money on and show them the cost of drug use and addiction and how that would significantly reduce their purchasing power. So a great, again, combination of things, again, highlighting, access to, improving their financial situation, and then how substance use is problematic to that. You may have, again, under number 4, some other ideas altogether for addressing financial dimension of wellness in with your young people or your clients or your customers in prevention. Environmental is another wellness component by SAMHSA, and the definition of environment is good health by occupying pleasant, stimulating environments that support well-being. So one example of how to implement that into prevention practice is number 2, encourage youth or young people, and youth or young adults or adults even, and give them opportunities to get outside and visit nature, visit a park, to walk, to play, play sports, exercise, meditate, relax. And then number 3, have students identify an indoor space. So number 2 was about an outdoor space. Number 3, identify an indoor space where they can go to experience quiet and contemplate, relax, listen to quiet music or nature sounds, and experience peace and calm to promote mental health and reduce stress. By the way, nature sounds can be online. So those are a couple of ideas from me as to how to actually apply the environmental dimension of wellness into your prevention practice. You can come up with some others. Spirituality is a dimension of wellness. The definition by SAMHSA is expanding our sense of purpose and meaning in our life. How can you apply this? Under number 2, give youth opportunities to meditate, to practice deep breathing, to pray, to enhance inner peace, reduce daily stress, and find meaning in their lives. Also, number 3, provide students with resources and opportunities. I think it's important to do both, resources and opportunities, to act on their values by volunteering to help others in their school, in their community, such as by serving on a youth drug prevention coalition. So again, here's a great, actually quite a bit of ideas might be stimulated by these 2 examples. You can go inward and focus on, inner peace and the spirituality, however you want to define that. But then you can go outward and make a difference in the world. Also really important to spirituality as well as social development. And so you may come up with some other ideas, but that's a couple that get you thinking about the spiritual dimension of wellness. A social dimension, social wellness is developing a sense of connection and belonging, a well-developed support system. How can you do that? Number 2, example I had was have students make a list or chart showing their relationships and the communication patterns. In other words, what's the direction of the communication, and maybe even what's the amount of time in each direction. And they can do that with their friends, their family members, and then they can even come up with how they'd like to change that communication pattern with their friends and family. And then number 3, have you set a goal to go places or do things that make new friends, especially friends that would support their living a healthy, active lifestyle. I'm going to pick up the pace because I realize we have so many slides here. Occupation is another dimension of wellness from SAMHSA that they defined it as personal satisfaction and enrichment derived through one's work. How can you apply that to prevention practice? Number 2, share resources with students about available local, regional, and state careers and work options, and have them make a list of possible careers, work that they'd like to learn more about, maybe even have them do a report on them. Number 3, introduce youth to careers in the substance abuse, prevention, and mental health fields. I think this is the last one, emotional health. Here it is, emotional wellness. It's coping effectively with life and creating satisfying relationships. How can you implement that within your prevention practice? Number 2, have students make a list of their strengths to positively express their emotions and their feelings and handle stress in their lives. And then those emotions and feelings and stress aspects that they'd like to improve. And then secondly, under number 3, have you set short-term goals to improve their ability to identify and to express their emotions or reduce their stress in their lives, including avoiding substance use, which increases stress and blunts emotional expression. So in conclusion, wellness is a critical component of successful recovery, also essential for preventing substance use and improving mental health of young people. And also, it's this prevention providers and other substance use and mental health professionals can use these dimensions of wellness to create strategies for integrating wellness and prevention for improving well-being. And I gave you just some examples there to get you going on that. Now, let's talk a little bit about adolescent well-being. Well-being is, according to the World Health Organization, is critical. World Health Organization talks about experiences of those ages 10 to 19. These experiences have a profound impact on their well-being, both in the short term and long term. In other words, well-being is sort of set in these years of age 10 to 19. And so the World Health Organization, along with another organization, is called Partnership for Maternal, Newborn, and Child Health, together with WHO, came up with this Adolescent Well-Being Framework, AWF. AWF defines well-being as adolescents that have support and confidence and resources to thrive. And the AWF initiative identified 5 interrelated domains, sort of like the interrelated dimensions of wellness. And you can see them here. Number 1, good health and optimal nutrition, all the way down to number 5, agency and resilience. So let's take a look at each of these 5 interrelated domains. And I'll give you, again, some examples of how you as prevention providers can address them. So these, like wellness, these well-being concepts like wellness are defined here as interactive, they're multidimensional, and prevention specialists and organizations can learn from these broader well-being and wellness concepts to strengthen their practices and programs that ultimately impact broader positive youth development. And really, that's what we're talking about when we talk about bringing in wellness to prevention. We're talking about a little bit more positive focus and positive youth development. So domain number 1, this is domain number 1 in this model for adolescent well-being. It's good health and optimal nutrition. Under number 1, you can see the subdomains. But if you look at number 2, I sort of highlighted some practical applications, providing information, education, resources, and services aimed at motivating you to engage in drug use and mental health protective healthy behaviors is a very important part of this domain. Also, sharing information about local resources for family, school, and community services and events that promote healthy behaviors, as well as implementing drug use prevention programs that promote youth health and healthy parent lifestyles and lifestyle behaviors, like Prevention Plus Wellness does, is a really good way to address this first domain of good health and optimal nutrition. So that's domain 1 in this wellness model, this well-being model for adolescents. Here's the second component of the model about values and contribution to society. You can see the first bulleted part identifies 6 different sub domains, but under that bullet, the second bullet has some highlighted potential applications that I came up with, offering youth opportunities to become a part of positive social networks to develop meaningful relationships and friend skills. You may already be doing this, but if not, you can think about this. Having them become involved in decision-making, personal responsibility, developing empathy, engaging with others by participating on prevention coalitions or youth leadership goals, and also having them set personal and professional goals to learn self-regulation skills and self-efficacy and to improve themselves in their schools and communities, all really important within this particular second domain of adolescent well-being. I know I'm throwing out a lot of ideas here. You'll be able to go back and reflect on these and integrate them in your practice or not, or come up with your own ideas. Domain 3 and the subdomains below that about environment. And you can see the applications I came up with, offering programs that prevent nonviolence, exploitation, bullying in schools, communities, and online, really important. And so are school policies and rights for all youth to participate equally and have personal safety, personal security, non-discrimination, as well as providing opportunities for youth to experience free time for relaxation, as well as to explore pro-social extracurricular activities are all about that positive environment and safety. That's domain 3 related to adolescent well-being. Domain 4 is about learning, education, skills. You can see the subdomains under the first bullet. The second bullet is some examples of how you can implement this that I came up with. Evidence-based programs that promote self-regulation skills, self-efficacy, motivation, self-esteem, that to avoid substance use, but to also identify a more positive future behavior and identity and positive behaviors related to health, but also they could be education, career, relationships, like Prevention Plus Wellness Program. Sorry for keep bringing it up, but actually that's what we're doing. We're integrating wellness and prevention. So that's domain 4. And the last domain 5, and there's the subdomains in the first bullet. And so here it's about giving youth opportunities to reflect on their current substance use and other health behaviors, like we do in our PPW programs, Prevention Plus Wellness programs, but you can do that outside of our programs as well. Achieving future goals, desired purposes, positive self-image, giving youth opportunities and experiences to reflect on and make choices that would empower them in the future and feel more comfortable about who they are and what they want to be in the future. So having them set goals, really important. Having them look into the future, really, really an essential strategy for positive youth development. And so the conclusion here is that prevention specialists and organizations can actually use these well-being dimensions or components like wellness concepts to expand their programs and their practices toward achieving broader positive outcomes with their target population. Lastly, there's 6 reasons that I could come up with why it's important for prevention to include wellness and wellness to include prevention. They're here listed. Number 1, youth are exposed to multiple health risks, not just substance use, but many other risks to their mental and physical well-being. Number 2, and therefore the need for more inclusive, broader, wellness-based intervention. Number 2, health risks are interconnected and influence each other. So that's the wellness and well-being concept. Number 3, wellness protects against substance use misuse. So in other words, more wellness, less substance use. Wellness protects against and improves mental health. The mental health is linked to substance use. Wellness fits with and completes prevention. In other words, it supports prevention, as we said earlier. That was one of the components of SAMHSA's wellness initiative and definitions, that wellness is prevention-oriented, but it's also future-oriented, positive-oriented, and it sets goals that go beyond just avoiding risk. And then lastly, 6, wellness empowers you to choose positive identities and behaviors. And that's certainly something all of us, prevention specialists, people, organizations that work with youth, parents, want for our youth. We want our youth to develop positive identities and behaviors. So let's go through these 6 reasons for integrating prevention and wellness very quickly. Number 1, youth experience multiple health risks. We discussed that in many of on our website, preventionpluswellness.com, and many of our webinars, and that's the focus that we try to. This is what we're all about. We're trying to get the word out, and the word has already been gotten out to those of you on this webinar, certainly, but you could share the word that youth are at risk not just for substance use, but physical inactivity, excess of screen time, skipping breakfast, other unhealthy behaviors, lack of sleep, uncontrolled stress. And it requires a holistic, much more of a holistic approach than focusing just on opioid misuse prevention. Essential to address opioid misuse prevention, but within the context of this broader holistic approach, that's what's lacking oftentimes in prevention practice. So here's, Youth Risk Behavior Survey, most recent data, 2021, showing you that 3/4 or more of U.S. high school adolescents are not getting the required minimum amount of sleep every night, 8 hours. They're not eating breakfast, let alone knowing how healthy it is. They're not getting their minimum hour of physical activity every day. And then you can see, not doing even worse on veggies a day, 3 veggies a day, only 11%, not eating 2 fruits a day. And yet 3/4 or more are getting 3 hours of recreational screen time. And so you can see these other health behaviors are happening at the same time as substance use risk, and they interrelate and interact with each other and influence each other. So that's the multiple health behaviors, risks that young people are experiencing, risk behaviors, which indicate the need to address wellness and prevention. Number 2, healthy behaviors protect against and improve mental health. Research shows that wellness promoting behaviors, physical activity, nutrition, sleep, stress control, protect against mental illness and promote mental health. Mind and body are connected, like wellness, SAMHSA's wellness initiative, behavioral health, physical health are one. And there is a recent study, or one done in 2020 at least, that one small example shows that the greater physical activity, less sedentary time, and the greater sleep duration, the better mental health, young people. Number 3 reasons why we should seriously consider integrating wellness and prevention is it improves positive identity and health habits. Wellness emphasizes positive goals, learning self-regulation skills, choosing a healthy identity and habits. And that is so important to the growth of young people. Providing youth and young adults with knowledge of the benefits of engaging in healthy behaviors, showing them models. It could be friends that are healthy. It could be online models. Oftentimes young people will see models of, peers demonstrating the use of a e-cigarette. We need more positive models, electronic models, any kind of model, physical model, actual live models of young people that are engaged in healthy habits, and have a healthier lifestyle. Offers young people the opportunity to empower themselves and having empowering images of themselves, and then asking them to think about themselves. A little bit more physical activity, a little bit more nutrition, a little more sleep, a little more stress control. You look more fit, active, healthy, strong, energetic, rested, calm, stress-free. Those image terms are extremely powerful, and you could use them in your communication with your youth, and they're integrated in our PPW programs because they're based on the behavior image model that underlies all of our prevention plus wellness programs. And you can use the behavior image model. It's on our website under resources. You can pull up the behavior image model and see how it works and how you can apply it to your prevention practice. 2, improve wellness images and motivation for youth to set healthy goals. Number 4 reason why wellness is essential to prevention and vice versa is, as you can see here, and that's wellness is not just about reducing health risks, but promoting good physical, mental health, performance, happiness. Really, it's the whole package, and young people need improvement in all these areas. We want our young people to be developed to their maximum full potential. We do as parents, we do as youth providers. So we want our kids to, even beyond that, we want them to be successful. We want them to have joyous relationships and work and contribute positively to society and to be happy. And really, we're so far from that in many cases with young people. And so your work is so essential to that. And so considering and I know I'm talking to the choir here with this group, but integrating more wellness into prevention is so very important for that. The ultimate goal of prevention is healthy youth development and wellness, not just the absence of addiction. Although the addiction is absolutely essential, avoiding addiction, preventing addiction. And then 5, lastly, promoting wellness protects against substance use, wellness promotion, wellness promoting behaviors, physical activity, nutrition, sleep, stress control, all counter substance use initiation and addiction. And so a couple of studies, for example, showed under number 2 that sleep patterns and duration predicted cigarette, alcohol, marijuana use. And number 3, one of our intervention studies showed that the multi-behavior sport intervention that targeted fitness and other health habits reduced multiple substance use, alcohol use, cigarette use, marijuana use, indicating the power of promoting healthy behaviors for preventing substance use. And then lastly, health risks, health behaviors influence each other. Engaging in wellness, health enhancing habits while avoiding substance use promote overall well-being. In other words, number 3, really, that's why I italicized it. Providing one without the other, providing prevention without healthy behaviors without avoiding substance use, it is going to fail in helping youth achieve the level of wellness, well-being, and full growth, full potential. So it's important to do both. And that's the conclusion. Really, that's the conclusion. Important for us to integrate wellness with prevention and prevention with wellness to achieve the true aim and focus of substance use, which is youth development, youth full potential. And so wellness providers like yourself, prevention providers, I should say, like yourself, can integrate wellness dimensions, well-being components into your practice. And so I'm just going to stop there. You can download a fact sheet on PPW if you want. You can look at a 2-minute video if you haven't. We're at preventionpluswellness.com. And you could reach me at info@preventionpluswellness at any time, or call us at our office number 904-472-5022. We've got a few minutes left, so we have time for Q&A. Let me pull it up and see if anybody left any information. And if you haven't and you want to, now's the time to do it. It's wide open. Go to your toolbar and look for the Q&A and put in any questions and comments. This is your last few minutes opportunity to share what you know or what you don't know or what you want to know with your colleagues here. I want to say in the meantime, God bless you all. Thank you for what you do. I always like to say that because I mean it, because you do the important work for youth, for young people, for families, for communities. And it's a difficult job and absolutely essential. So if we can help in any way, to provide you with resources or support, just let us know at Prevention Plus Wellness, preventionpluswellness.com, located here in St. Augustine, but we have programs in all 50 states and abroad. I'm just looking at the chat space. I just see some kind words and some introductions. You got a couple more minutes. If you want to say anything, go to the Q&A. I'm just seeing. Now, remember, no need to email me. so I will send you all an email today, and it'll have a link that goes to our site. And in that site, on that site, you'll have these slides with all that extra content and information. We went through these very quickly, and there's so much here that I think I'm hoping that you'll find something of use. And I'll be sending that to you. The link will have the slides, have this recorded webinar, and have a CEU certificate. So it's all there. If you don't see it at the end of today or tomorrow, then check your spam folder because it's likely to have gone there. But other than that, you're going to get all this stuff And there's a lot of links to these slides, and there's just a lot of information. So please do use it. Please do share it with your colleagues, your friends throughout your region, throughout your state. And again, if there's anything we can do to support you to integrate wellness and prevention in your practice, let us know. Love to do it. Our next webinar is just another couple weeks, something unique. We just updated our In God's Image faith-based program to now be titled what's it, the AA title for God or a higher power, a higher power. I forget that. Our In God's Image program is now titled A Higher Power. It's the same thing, really, but more content has been upgraded. So I'm going to walk you through that program. If you're interested in any kind of a faith-based program where it addresses prevention and wellness for young people, do join us in 2 weeks, same time as always. And I don't see any questions or comments, so I'm going to say goodbye. Thank you all for joining us. If there's anything we can do, reach out, let us know. Have a wonderful day, and thank you for being with us, and keep up the good work, and take care of yourselves. Bye-bye, everyone.